When the human genome has been sequenced in early 2000s, the whole price was in billions.
What is the next big thing in biotechnology? And the answer is kind of simple if you are in the field. You need to know how to sequence DNA, fast and cheap.
This is a great opportunity when people of different background meet and talk.
What I do is try to understand biological systems using quantitative mathematical equations and physical thinking. And from that, one day, walking in the corridors, I ran into Stas.
I work for IBM Research. My occupation is electrical engineering. To be more specific, that's device physics. I help IBM to make microprocessors.
We bump into each other and we discuss what can we do that has biology and has silicon technology to it. And we came up with this concept of the DNA transistor.
So we talk to each other. This is biology perspective, this is electrical engineering perspective. I bring my expertise. Gustavo brings his own perspective. Bingo, we have an idea.
What we are trying to do with the DNA transistor is to sequence DNA. We want to control the passage of DNA through a pore.
This nanopore will allow a single DNA molecule to thread through this nanohole.
This device that is formed by a pore and a few electrodes, they're tiny, allows us to make a DNA go through this little pore and be trapped by the electric field created in these electrodes. As much as trapped, we also can get rid of this electric field and the DNA will traverse through the pore a little bit and we trap it again. And each time we trap the DNA, we can do something with it. For example, interrogate each base and ask, are you a C, a G, an A or a T? And that will allow us to sequence the DNA.
I would say DNA transistor, it's a different kind of device. It's made of the same materials we use to build microprocessors. So it's not that a far jump.
The beauty of it is that it uses technology that IBM is very good at doing, which is a mixture of nanotechnology, very sophisticated atomic layer deposition and chemical vapor deposition, all kinds of technology that has been very much at the forefront of the thinking and innovation in IBM.
Personally, I'm excited both like DNA sequencing and other possibly revolutionary applications that this device may enable.
The notion is that that will allow us to understand maybe why a drug, medicine works for a person and not for another person.
You can identify your possible health problems in the future, and your doctor would prescribe you medication that suits your genetic composition or genetic information.
The DNA transistor is one of those technologies that will, in the longer run, achieve sequencing very cheap and very fast. The reason is because you don't have to do any particular great, complicated and time-consuming and cost-consuming manipulations of the DNA at the input of this device. So almost fully electronically, you might be able to retrieve the information of what is in the DNA. The holy grail, the gold medal of the DNA sequencers is get the sequencing of one human genome to cost $1,000. But you know, that will be a milestone. When we get one genome to be sequencing $1,000, then personalized medicine will become a reality.
Again, this is in very, very early research stage. Potentially, it's a very powerful idea.
I'm trying to keep my eyes in the sky, but my feet on the ground. And so the reality is we want to be there, but where we are, we have a number of steps before we can overcome all the limitations. Having said all that, we expect that with the DNA transistor, in principle, in a matter of a few hours, you should be able to sequence the human genome.
Yes, I say DNA transistor is very good, but in general, can we be more broad? Can we apply electronics to some other cool stuff?
Our team is great. All these people talking in the same room enrich the discussion considerably.
It's a great collaboration. I love my colleagues.